Welcome back to CTV Morning Live. We have Paige Dr. Paul. He is here. He is the CEO and Medical Officer of Health Eastern Ontario in the Health Unit there. Great to have you back on the show.
Nice to be back.
And so I'm understanding this week is International Immunization Awareness Week.
The first ever International Immunization Week, actually. It really is a worldwide attempt at recognizing that how important vaccinations have been. And if you look at the last 100 years of progress, by far one of the most important things that have been discovered have been vaccinations, because we're now preventing diseases that are literally incurable and would kill millions and millions of people. You know, in the 1800s, 1900s, we think that it was natural death, and it wasn't. It was, you know, viruses and bacteria that we couldn't really treat. And even today, a lot of the vaccines that we have prevent diseases that are otherwise not treatable. And so, you know, I know there's a lot of people talking about, you know, what vaccines are. It's not a natural way of protecting myself and so on. But if you look at pre-vaccine and post-vaccine in terms of the numbers of diseases that are out there, it's remarkable the difference that it's made. And what people don't realize is that when you immunize yourself, you're immunizing the world or your community, because by these germs depend on living in myself or yourself, right? If they can't live in me or you, they won't be able to spread. So the more people that are protected against these viruses or bacteria, the less that these bacteria will be in our community. And that's what we see all the time.
There's the first time for this international flare, because there's one thing when I think you'd have a lot of us thinking, okay, we're talking the flu or the pox or something like that. We're on an international scale. It's much larger in terms of the diseases that you're fighting.
I tell people 10 million, the number 10 million. And people say, well, what is 10 million? 10 million is the number of children less than 5 years of age that die on a yearly basis in the third world.
10 million,
10 million
a
year.
year.
Remember Bono did this sort of, had this every time you click your finger a child dies? That's what happens. And if you look at the top 10 causes of these deaths, I would say half, if not more, are due to vaccines that today in North America we prevent. Measles, for example, diarrhea, pneumonia, all these things we have vaccines for, and in those countries they don't have the vaccine availability. So that's why we have that international flare, because yes, we need to continue getting immunized in our country, here in Canada and North America, but in developing countries they actually struggle. It's a luxury for them to have the vaccine. And like I said, 10 million kids a year, less than 5 years of age, die.
That's a really horrible statistic.
It's a horrible statistic that I learned a couple of years ago, and I was stunned. So I use that as a sort of an ammunition, or really to explain to people how well we have it here in North America, that we do have the vaccines, and in those areas they don't.
We do have the vaccines here, and yet there's always the choice, right? And then I'm sure as a pediatrician and being in the office, you know, you have parents that say, well, I've read on this, and I'm thinking I'm not doing this. Is it frustrating for you, or do you realize that you're passing on the information to say, this is what we've done, this is what we're protecting?
Well, this is what we're trying to do. We're trying to take a logical approach to it. And anybody out there who doubts it, I think they should look at at valid evidence-based sources and not rely on just internet blogs on anecdotal information by people who are not experts in the field. You know, any expert in the field, any expert organization, American Pediatric Association, Canadian Pediatric Society, you know, all these associations look at evidence, and we look at the risk and we look at the effect and the benefit, right? And really, the benefit far outweighs the risk of any of these vaccines. And like I said, we have no choice. Either we succumb to the disease or get vaccinated, because really some of these infections like polio, diphtheria, all these, there's no cure. You die from these things, and if you don't have the vaccines. But
we don't see those cases here anymore.
Well, because why? Because we have the vaccines. In Britain, actually in Russia, when they had problems when the Iron Curtain went down in the 1980s, all of a sudden they had a breakdown in their immunization system, and they started getting diphtheria. I've never seen a diphtheria case in my life, because we take it for granted that it's not there, because we protect ourselves, and by protecting ourselves, we protect our community.
There's a lot of information, and you've just produced a video, right?
Yes, we did a video with the Public Health Agency of Canada, and it's just go to our website, eohu.ca or immunize.ca, and you can get a link to the video. It just talks about the importance of getting you and your family immunized for the benefit of your world and your community.
Okay. There's the immunize.ca. You could head there and find the link to that YouTube to be able to put that information. It's amazing now that, you know, doctors are using YouTube as a vehicle to get information like this out.
Powerful weapon and powerful medium to be able to get your information out there, because a lot of people are using it for negative messages. I think this is a true way of using it for a positive message to go through that really is impactful and important for you and your family.
Now, is there a date? Is there an expiry date on at what age and when you need to be doing some of these things. So you might realize you've missed out on some, but you can catch up.
You can always catch up. The other thing too is there are vaccines for adults as well, and it's a good point. Actually, you should be getting a shot every 10 years that updates you for your diphtheria and your tetanus shots. And there's also an extra whooping cough dose that you can get. So please talk to your doctor or your healthcare provider to see if you and your family are up to date, and if not, it's very easy to catch up.
I wouldn't have even thought about that. Amazing. Thanks for the information
No
today.
problem.
And again, immunize.ca, you can find more information and get a link to that YouTube, the new production that they just put together.